My parents would sometimes come into my room and tell me, it's going to be okay, just focus on your studies, focus on moving forward, focus on getting better. And that was their way of trying to love me out of the pain I was going through. But at the time, it felt like they just couldn't understand that that wasn't going to be enough. My name is Sahaj Kohli, and I'm also the founder of Brown Girl Therapy. When it came time to starting Brown Girl Therapy, hence the name, it really was supposed to be a place for South Asian women to be able to talk about their mental health in very candid ways. And I really wanted to facilitate those conversations. I had written something about self-care for children of immigrants, and from that moment on, the page just blew up. I could not have anticipated it at all, but at that moment I knew that there wasn't anything that existed for children of immigrants and their mental health. Even though we're not a monolith, there are still so much overlap between our experiences as second generation, as for 1.5 generation immigrants who are really trying to bridge the relational divides with our parents and our ancestors and our elders, who are trying to come to terms with values and culture and health and success, and we're trying to discern what it means to live authentically while still honoring where we come from, who are trying to discern what it is that we want versus what it is we're being told we should want. I think when the pandemic hit, a lot of people were stuck in environments or with people or in situations that maybe weren't necessarily healthy or good or positive. A lot of the conversations turned very quickly into seek help, seek a professional, access care. Here are the basic ways to take care of yourself and self-care while you're at home during a pandemic. And those kinds of conversations, they're not inclusive. They're not inclusive to a population where, and when I say population, I mean children of immigrants, where self-care has never been encouraged. It hasn't been encouraged for anyone in our community to put themselves at the top of the list. A little over a decade ago, I did experience something traumatic that led me to want to seek out professional services. I was living with my family at the time. I had all of the symptoms that I thought were depression. And so when I tried to open the conversation with my immigrant parents, it didn't go quite well. I think my parents took it as a personal attack on their parenting style, that I was struggling and that they couldn't help me get out of this struggle that I was experiencing. So at that time, I really, butt heads with my parents. I guess what I realize now about then is that there was a lot of cultural and generational differences between the ways that we thought about mental health, the way that we thought about how we take care of ourselves, and the way that we thought about just kind of powering through when you're struggling. I was able to finally seek the help that I needed when I honestly got the distance from home. My parents did the best they could with what they knew. That's not to absolve them of any pain and hurt I might have lived through when I was younger. I'm doing the best I can, but I also have access to so many more resources and opportunities than they ever had. I can't imagine how difficult it must have been for my parents who, at the time were probably in their early and late 20s, moving to a new country where they had to start to learn the customs, the culture, just the logistics of even paperwork or getting a house or a credit card or any of the other things that, might be different in other countries. A lot of what I see in the community are people saying, well, my parents just want me to put my head down. They want me to power through my struggles. They want me to save face. They want to consider, family reputation in the community. What other people think is really, really important in a lot of our communities, because all these immigrant parents had really when they moved to this country was the community that they created. So for them, that is their family. That is who they want to be on good terms with. They don't want to be gossiped about. They don't want their reputation to be tarnished because of something their kids are doing. Whereas when I talk to children of immigrants, it's like, this is not tarnishing the reputation. I just want help. Not only was I creating a space in brown girl therapy for children of immigrants to be able to come together and talk and have candid conversations and learn about their mental health struggles, but I was also representing a very small population, BIPOC, let alone South Asian, let alone Sikh therapists in the United States. And that is something that I get messages about all the time, is just how much there's a lack of diversity and how much there's a lack of understanding from some clinicians on our experiences, because they aren't taught to consider culture and differing values and bicultural identity, these other intersection of our identities that really impacts the way we engage with our mental health. For any child of immigrants who might be struggling and is struggling to even seek the help that they might need, my advice to you would be to try to find one ally. There has got to be one person who you can talk to, who you can trust in. It might not be your parents, it might not be, even a sibling, it might be a friend or an acquaintance or a mentor who you can talk to about what you're dealing with, to try to take the first step to understand what your options are for seeking the help that you need. When things feel uncertain and when things feel a little bit scary, try to remember that it is temporary, that there is someone you can reach out to who will care about you, and of all things, that there is so much waiting for you that you can't even imagine, and that can sometimes be really exciting when we reframe it as something positive rather than a fear of what is unknown.